everybody. Here we are. We've got a great opportunity to share with you a podcast on insomnia. We've got, of course, Dr. Amy Banter, and I'm Eric Banter. We kind of wanted to share this because there was a lot of hits on our sleep podcast. I think we're grateful to be offering these also on YouTube, which is why you see some of the video here, if you enjoy that as well. But as we're out here finding more ways of integrating our four pillars, the breathe, eat, move, sleep, it did surprise us that sleep it's a big hitter.
It was the top.
It's number one. It still is number one.
Mm-hmm.
So
it shouldn't, because honestly, in the office, I
was
thinking
see
about
patients,
this.
so.
But studies show, I guess, like 40% of people suffer sometime over the past year difficulty sleeping, which is insomnia. And I would say almost, I feel like at least 2 out of 3, 1 out of 2 of my patients come in.
Well, what are these symptoms?
Sometime have suffered from it.
Of course, energy and...
Well, the thing is, it obviously becomes an issue that is bothersome in their life. And I think when a lot of people start coming in to talk to me about it, like what can I do, medicines, whatever it is that it's like I'm exhausted during the day, I'm having trouble focusing, can't fall asleep, and then I can't get up in the morning, and I'm not as productive at work.
Emotion probably.
And mood issues, and it impairs our quality of life and what we want to get done.
So it's affecting the brain.
Right,
I mean, a big part of it is taxing the physical body, because the sleep is the time. I'm just reiterating stuff you told me. Sleep is the time the body wants to heal, and within that also the brain and the brain chemistry. And
if you haven't had a chance, you really should listen to our first podcast, because we did a really good job, I think, of going over.
Go back
sleep.
And watch that again.
Well, it talks about why sleep even matters. Why is it important? What happens to our body? We're not going to reiterate all of that, but I did want to talk about just the effects long-term of insomnia, actually short-term and long-term, because it's really interesting. Why do we even care? We talk all the time about, obviously it's one of our 4 pillars, and we talk all of the time about you need to have at least 7 hours of sleep, and there are scientific reasons for this. One of the biggest things is looking at longevity. And I talk about these telomeres a lot, and if you look inside our body and our cells, at the little tips of our chromosomes, there's something called telomeres, and they're almost like if you look at a shoestring, and there's like those little plastic tips on that.
Yeah.
And those telomeres naturally are going to shorten with time and age, and usually then what happens is if they get so short, then it's almost like a shoestring, right? The shoestring starts unfraying. And the same thing happens with chromosomes, and you get cellular aging, cellular death, disease. There are certain things that can prematurely shorten those little tips, and there are things you can do to reverse it, or even just to slow down that shortening.
I love that analogy, because I think of the shoestring. And I mean, we've all had shoestrings, and that little plastic thing wears out. And then next thing you know, it frays. And when it frays, you can't put it back together.
Get it back.
So I mean, that's the whole point of what's happening in our cells with the chromosome. And those, we want to keep those telomeres, or that cap engaged.
That little cap.
When we lose it.
And one of the things is we know that sleep has been shown to affect your telomere length. Specifically, less than 6 hours of sleep becomes.
Are you saying
5 to 6
because
hours
you like
of sleep
sleeping?
becomes an issue. I do like sleeping, but obviously I'm very intuitive. I know it's important for me. And at that 7-hour mark, and it's interesting, 7 to 9 is kind of that golden hours of where you see the lengthening or the positive benefits to your health. There are even some studies showing like too much sleep, like over 9 hours, could also have some negative effects. So it's almost kind of like a little
ask
shape
yourself
curve.
why. It could be depression, could be a lot of different things that lead into that.
Yeah, thyroid's off or something like that. So anyway, sleep does affect your longevity.
So one thing I want to say on that too, Amy, is I know I use my iPhone, and I think I've shared this before. There's a bedtime function. And so I say, hey, I want to get 8 hours of sleep. And then it goes, ding, it chimes when it's time for me to go to bed. What's nice about it too is I can go back, and there's a report that says how much am I sleeping. And so right now I think I'm 7 hours and 20 minutes or something. I mean, if you go back months. And I know I'm trying to get more, but
it's really good. Even, and I don't know if we have the same one. The one I have even records like snoring, and it records movements.
And then we get into arguments as to who was
snored.
it. One time it was Smash. Yeah.
But it does look at your quality of sleep too. So how many times are you moving around? Are you restless at night?
Right.
And it's funny that chime. It's shocking because I think we all get busy and caught up, and then you're like, oh my gosh. And I think we always have good intentions, but your chime will go off usually I think 9:30 every night, and you're like, wow, we need to slow down. And it does.
We haven't even got an episode of Veronica Mars in or anything.
Right. So, and sometimes TV can distract us all. So longevity. The second thing is cognitive impairment, meaning like our mentation, our brain health, and all that. And this is probably one of the very first areas that gets affected by total sleep deprivation, meaning, we get busy, you worked really hard, you went a day or two without sleep. Your focus, your alertness, your attentiveness, all of that kind of stuff quickly gets affected. So your brain, you may be more forgetful, you may be spacey, you may forget things, you may not stay focused or be as productive that day. Once you restore your sleep, though, you can quickly regain that. So that's not necessarily a permanent thing, but that is
something
a short-term thing that it's important, because I used to be horrible about I would stay up late and I would cram for a test or whatever, and I probably did more harm than good. But anyway, now, hindsight's 20/20. Now I'm really cognizant. If I have a board exam or something like that, I'm just like, got to get my sleep. I've learned all I can. And what else? The next thing we were going to talk about was mood. And it's interesting. They've done studies and shown that people can actually start developing signs and symptoms that appear to be depression. Can be the exact same things: irritability, low energy. When we do all these like little mood assessments to see if somebody's depressed, sometimes decreased appetite, increased appetite, those type of things, decreased libido, poor judgment, those all can come from sleep deprivation. And again, as soon as you restore your sleep back, all of those reverse, showing that it's not necessarily depression, but your lack of sleep was affecting your mood.
It's probably dependent on the individual, but would you say if you had 4 days, 7 days of good sleep that you should see a difference? Is it, I know you said it's pretty quick, but what is that rate? I wonder. That's
a good question, because I don't even know if I know that answer. But
you would feel a difference probably after many days.
Even a few days.
Right.
Yeah. So, and it's hard. I do feel bad for the people that are on like swing shifts and shift work. And we'll talk a little bit at the end of this about just some natural things that people can do for that. Another interesting thing, heart disease. They looked at like 20,000 adults. And they found that those that had less than 6 hours of sleep had 15 plus % greater risk of heart disease.
Wow.
Just lack of sleep. And what they think happens is that you get increased inflammation, and these markers, like one's called CRP, and we know that inflammation can start causing damage to blood vessels, make your blood thicker, make you clot more. So now we have like actually some evidence showing that lack of sleep can increase your risk of heart disease, even make you form more plaque at a higher rate than people that are getting good sleep. So it's important for your heart.
There's a lot of good reasons why you should sleep.
There are. Immunosuppression, that is huge. And I was classic. Like finals, I always got sick after finals every semester in college. And what happens is these things called cytokines, that they're like proteins that help your body fight infection and inflammation, and you don't produce those cytokines as well when you're sleep deprived. And so you're just more likely to get sick or not be able to fight off viruses. It was interesting, they did a study and looked at people after they got the flu shot, and those that were sleep deprived did not respond and mount an immunity as well. Interesting. Yeah. And then the last thing that a lot of people I think hear of and is a concern, obesity metabolism. It really gets affected if you're sleep deprived. All kinds of markers get off. Leptin and ghrelin, which help control your appetite, get affected, and so you, when you're sleep deprived, you'll feel more hungry, and like you just feel like you can't get full. And I would always, when I was on call and I'd be up like 48 hours, I felt like I was starving for 2 days afterward. And looking back, it was this messing up of my chemicals. Your cortisol gets off, and we know that high cortisol, when you're not, because when we sleep, remember, it's like a restorative time that we're supposed to regenerate. And if we are not sleeping, our cortisol gets high. When our cortisol is high, you get more belly fat, you get more
because that's our stress
deposition.
response, right? And the idea is it was needed for fight or flight, but it wasn't needed in our culture constantly to be on.
Right.
And so the sleeps, well, we're under a lot of stress, so we're getting the response there. And then you're saying compounding on that is if we don't get good sleep, then you also have an opportunity to release these chemicals that are really a stress response. And that's where the belly fat, the cortisol.
And I have people, and again, that's why we really came up with these 4 pillars, because it's not one of these that's going to balance your life and help your health and promote longevity, because I've seen people that come in and they eat great, they exercise all the time, but they're stressed and they don't sleep. And until they address those, I mean, really, I've seen it over and over and over again in patients. Until we can get restorative sleep, which also helps your stress, which then balances everything out, then you can start seeing they'll burn the fat and lose the belly fat.
And what a great habit to start, especially if you still have kids, because it shows them the importance of sleep, right? Not that we're wearing this as a badge. It says, I get 4 or 5 hours of sleep. And you can for a while, but it's just not good for your body at all. Definitely not good for your longevity.
Well, I had a patient, I think Friday, and she said, I just don't need sleep. I just never have. And I mean, literally, I think she gets 4 hours every night. And she said, I feel good. I've got good energy. But she has high cholesterol, high blood pressure. Because we were talking about, why is your blood pressure still up? And
it's not funny, but we're laughing because our dog is in the pond down here, and I think he just jumped after some fish. Anyway, you're patient. I apologize.
Sorry. That's why we're not doing the podcast outside. He's too noisy. But anyway, you don't think you need that sleep. I think that a lot of people are like, I feel fine. And it's kind of like we talk on this, you're on this spectrum of health, and in the middle is healthy, I feel well. But yet, sometimes you can have some silent disease going on, right? We've talked about this all the time, that it's not just an overnight thing that you go from healthy to sick. There is a spectrum, and there are things going on at our cellular level in our body all the time. And so our body's always trying to balance and restore and keep everything working like it's supposed to. And sleep is one of them that we have to do, because we just talked about all these effects on your health that can occur. And so I guess let's talk about how can we treat insomnia.
Okay.
And I am
that would
a
be helpful.
That's right. What can we do about this? I am a proponent of trying everything as natural as we can, because again, if we give our body what it needs, it is amazing, and it makes all these chemicals, and it is designed to heal, and the body wants to work right and keep things in balance. A lot of people come in wanting sleeping pills. They've tried everything, and interestingly, there's a lot of studies, even with over-the-counter sleeping aids, because the Tylenol PM, the ibuprofen, Benadryl combinations, or the Tylenol Benadryl combination, most of those, if they say PM, like Advil PM, Tylenol PM, have Benadryl in them. That's an antihistamine, and histamines get high for different reasons. Antihistamines, one of their side effects is sleepiness. So a lot of people take that, but you can have ill effects of long-term use of antihistamines, even over the counter. They've been put on this list of meds that anyone over 65 should not take them, because there's a higher risk of memory trouble and dementia. And for all of us, even these over-the-counter ones, you may feel like it's helping, but it makes you more groggy, or it may affect you being less focused, reaction time may be less. So I really think if we can do things as natural as possible, and we'll talk about foods and supplements.
Or breathing exercises.
And sleeping meds, prescription or over-the-counter, all have that risk of affecting our memory. I mean, I've seen people sleepwalk and do things in the middle of the night, eat things that they didn't know what they were doing. So There is a cascade of chemicals. We all hear of tryptophan. Remember, like
we always think of that
the big turkey meal and increases your tryptophan. Tryptophan eventually leads into melatonin, and it works through this little chemical pathway. It's like tryptophan, 5-HTP, which a lot of my patients might hear me talk about 5-HTP for treating mood and insomnia, and then 5-HTP goes into serotonin, melatonin. So there are different ways along this pathway. You know, we all hear of melatonin. A lot of people take melatonin to help you sleep, and it's great. It's a very effective treatment, but
our body does it naturally.
Safe. And we talked in our first podcast. So again, you might even want to refresh and listen to that. But we talked about there are certain things that will impair our production of melatonin. Remember, it's the light in our pineal gland. So if we are, you know, naturally as it gets dark and our brain senses, oh, it's time to go to bed, we start producing melatonin. But we leave on computers and blue light and lights in our house, and we work
dinging phones
into the late hours of the night, and so our brain doesn't always get those same signals that, oh, it's time to go to bed and produce melatonin. So you can take melatonin. It's really been shown to be very effective in shift workers. So if somebody worked an evening shift and needs more restorative sleep, that's a good solution for you. So melatonin supplements, you can get them at the pharmacy.
Oh, really?
They're over the counter. So low dose, 1 to 3 milligrams. You don't need to take crazy high doses. Sometimes you can throw off, because of the feedback mechanisms, other things like your serotonin, or you can feel too stimulated. So don't overdo melatonin. Naturally, we can eat foods that increase melatonin through like tryptophan, turkey, poultry like chicken, eggs, salmon and shrimp, nuts, soy, bananas, think pineapple. But there's different things you can do that in your diet. So I think if you can try to eat healthy foods, even at bed, I was reading a snack like cherries, I know can increase your melatonin. So like maybe a little bit of cherries, or even having some of these little snacks like we talked about, just a little bit if you are feeling like you're struggling to settle in for the night. Milk, you know, the hot milk, it really does, I think it increases it through tryptophan and can help increase your melatonin. So there are foods you can do that maybe would help you be able to get a better night's sleep. And if you're paying better attention during the day to just a better, well-rounded diet, you're going to have more of those amino acids, which tryptophan, 5-HTP, those are all amino acids that then lead into serotonin and melatonin. Remember, serotonin is that mood chemical, and so you know, even just eating well to support your serotonin is important. I'm excited to talk about some. We're going to start a book club.
Yes, you are.
I'm going to have a book club monthly, and one of them.
Stay tuned for the book club.
It's a good book that talks about just foods to improve our brain chemicals and our mood chemicals. So how we can naturally eat a diet to support our serotonin and dopamine and things like that. So this is
how will that resource work? I mean, in your book club, you're going to just basically pull out some of the pearls that you liked in the book?
Review a book, and I think every month we're going to start with Dr. Hyman's food book. So that is my first
Dr.
one.
Hyman.
And I'll talk about that on our first one, and just give an overview and give people maybe a month to check out the book and read it if they're inclined.
Yeah, awesome.
So what others? So we talked about food. Oh, magnesium, big one. We take it every night. Magnesium is very helpful. It increases Gaba and increases your melatonin.
Don't take too much.
So you have to be careful because it can cause a little GI loosening if you overdo it.
Yes,
but
that's well put.
So most people take anywhere from 250 to 500 milligrams safely.
That's the citrate, though. That's the one that has the.
Yeah, we like something called Calm Mag, which is, and again, I've seen it. I just saw it at Kroger the other day. You can get it on Amazon. It's a powder, very well absorbed, and I think less side effects. I think there's 325 in 2 teaspoons. So I usually tell patients start with 2 teaspoons and then you can back it down to 1.
Right.
But it's very good. It's a relaxing, lowers your stress. Magnesium and some of these other vitamins are cofactors, which means they help your body's chemical reactions work that make things like melatonin, serotonin, things like that. So I think everybody honestly benefits from a little magnesium. Gaba is another chemical that I use, a substance that I'll use. It's just a natural supplement. Gaba is more like an amino acid, and GABA is that calming chemical in our body. And so it's that if you don't have enough GABA, you can feel a little more revved up and anxious and have trouble sleeping. So GABA is an easy supplement you can get over the counter as well.
And then natural, I've heard of the Valerian.
Valerian's another one that is very safe. It's also, it's got more sedative effects, so you do just have to be careful, because you can, just like anything, you can get too much and then feel really groggy, have trouble waking up in the morning, but it's very safe. So yeah, valerian root. I like doing oils, like lavender oil too. Yeah. It's a good thing. Some people look at ingesting it. You got to be careful. It can cause like upset stomach and GI distress. So I really just would recommend that more as essential oil. Smelling it, I often will put it on my temples or on my arms, and just as that. It's good for kids. Very safe. Chamomile tea, passion flower tea, so you can just have a little tea. We're settling in for the evening.
In your Purdue University mug.
That's right.
Yay, go Boilers.
But yeah, chamomile also increases your GABA, which again is just kind of getting your body to relax and calm. And the only thing I would caution there, and I don't see it tons anymore, but kava was something that a lot of people used for a long time for anxiety and sleep, but it has a lot of liver toxicity, so would not use that. The ones that we talked about here are very mild and neutral, and non-toxic.
And we'll put a lot of these in the notes too, so if you're like, okay, what did she say, just go back to the front of either the podcast, we'll put it in the YouTube notes as well, so that you've got some of these references, or listen to us again.
That's right.
Anything else you can think of? That's a lot of information, Amy. That's really, really good. We definitely appreciate you having all this knowledge and being able to share it. I mean, what a wealth of information. We hope this has been very helpful for you. And if you like this podcast, obviously, down at the bottom, hit that subscribe, like us, give us some feedback. Let us know if there's some other topics that would be very helpful. And as we get that, then we're just kind of providing that. But we're grateful for the opportunity to serve you. Coming off here with our OPT2LIV, Breathe, Eat, Move, Sleep. Check us out, shamrockwellness.com. We hope to see you soon. Have a great day.
Cheers.